Hello, and welcome to today's webinar titled The Art of Innovation, Digital and Clinical Transformation at Jefferson Health, presented by Healthcare Informatics. My name is Rajiv Leventhal, Managing Editor at Healthcare Informatics. Today's program is sponsored by Appian. Thank you to our sponsor and to our audience for giving us your time and attention today. And at this time, I would like to introduce the speakers for today's program. Neil Gomes is the Senior Vice President for Technology Innovation and Consumer Experience and Chief Digital Officer at Thomas Jefferson University and Jefferson Health System. At Jefferson, Neil drives digital innovation in healthcare, consumer experience and engagement, training, and education. He is joined today by Robert Neff. Robert is the Director for Innovative Technology Solutions and Platforms at Thomas Jefferson University and Jefferson Health System. In his role at Jefferson, he leads teams that develop applications and mobile apps, digital properties, and leverage new and innovative technology to improve the consumer experience across the university health system. Thank you, Neil and Robert, for taking the time to speak with us today. And with that, the audience is yours.
Hello and welcome. This is Neil Gomes. I'm assuming everyone can hear me. I'm the Chief Digital Officer, as Rajiv said, and Rajiv, thank you for the introduction. At Thomas Jefferson University and Jefferson Health, and joined with Rob, one of my team members, who's the Director for Innovative Technology Solutions and Platforms, and on my team. Okay, I'm just verifying with the rest of the presenters that they can hear me.
Yes, we can.
Yes, oh, perfect. Thank you, Rob. Great, so I think we'll start off very quickly. I'm hitting the next slide. I did notice that the fonts are a little bit different from our original presentation, so if there are some aberrations, I will explain them. I always like starting with the slide. You know, win-wins in the real physical world are many times very difficult to achieve, and but you know, we believe firmly that win-win-wins, not just a two-way kind of thing, but are real are possible in a digital universe, especially where the consumer wins, Jefferson as a health system and an education system also wins, and and teams like ours who help the organization transform and move forward also win in the process, that we do meaningful work and we do it for the benefit of patients and students. Two of what I feel are the most noblest causes, you know, that you could associate with learning and healthcare. So before I go into explaining what we do and how we bring about digital transformation in these two very challenging industries, I just wanted to put some context to the environment in which we work and also the groups through which we work. So first, the environment. We are primarily based in the Philadelphia area, now in New Jersey also, and surrounding areas. So Philadelphia, if you're not familiar with Philly, has a lot of saturation in terms of universities and health systems in the area. It's also an innovation hub. You know, there's lots of very large companies, not just in healthcare and education, but in other industries such as telecom and you name it, you know, Philly has it. We're also very, very close to New York and DC, so we have a lot of influx of ideas, people, companies and organizations from those hubs too. It's the fifth largest city in the country and really the second largest city on the East Coast. So all of this means that we operate in a highly, highly competitive environment, a highly innovative environment. And we live up to that. Jefferson does pretty well in that space. So to give you some context of who Jefferson is and because not a lot of people know about this, and to understand it a little bit better, the more near and close environment that we work in. Thomas Jefferson University and Jefferson Health is both a university and a health system. Currently, we have about 11 hospitals. When I joined 3 years ago, we were about 3 hospitals, so we're growing very, very rapidly. We have over 28,000 employees. We also recently announced the merger with another university. So we're not just, increasing in terms of the healthcare side, but also as a university, increasing our portfolio. So the biggest metric and the most impactful metric in here really, and what's more key to this presentation today, is the third point. We really impact 1.9 million outpatient visits and several patients in that mix. We do about 350,000 plus ED visits and about 96,000, almost 100,000 admissions in our hospitals a year. So that's a lot of impact, I feel, at least in the healthcare space. We do about $4.8 billion in revenue a year. We also are a research institution, so we pull in some research dollars. We have about 3,200 faculty, full and part-time, 3,900 students, plus with Philadelphia University coming in, would increase it to over almost 8,000 students. Not many people know this, but Jefferson is the second medical school in the nation, been around for nearly 200 years. If you've heard of gross anatomy, Samuel Gross, who developed that concept, was a Jefferson physician. Jefferson has also invented the heart-lung machine. And so there's lots of innovations that we're known for. We are the first and only college of population health. We have an Institute for Emerging Health Professions that creates curricula for healthcare professions that are of the future, that are not yet here, but we kind of proactively develop those jobs and positions into the future and careers into the future. So we're very much on the leading edge, both in the healthcare space and in the education space, and my teams have to live up to that reputation too. So that makes it not challenging but exciting. And this is a little bit of a construct of our teams. I have 4 teams in our Technology, Innovation, and Consumer Experience group. We're very, very particular about design, and so we have a Digital Consumer Experience group, and the ethos of that group is that design is how it works and not just how it feels or looks like. And that is actually a quote by Steve Jobs, so it drives us. Design also determines what we work on. A lot of times we get people coming to us with a proposed solution and want us to execute on it. But we want to be involved in that process of decision making, whether really the solution that the folks are coming to us with, the proposed solution, is really a true solution, whether it addresses the problem, whether they will realize the outcomes they want to realize if we fix that and work with them on it. And if so, then great, we do it the way it came to us. If not, we really reveal to people using design, using process design, using some ethnographic embedded design principles that we have, where we go into those environments and determine if that problem really exists, whether the solution that was proposed is one that is really going to address that problem, and if the problem itself, if solved, results in the outcome that those groups were hoping to achieve. So we've developed a kind of reputation within our community that we can help in those areas, and that helps us ultimately determine what we do. So the Innovative Technology Solutions and Platforms team, of which Rob is the director, and he's on this webinar, the ethos of that group is to work really like a lean startup, develop solutions that matter, and then do it really quickly and do it in an agile way. So that group really is led by lean startup and agile methodologies, is driven by them, and we produce solutions and develop solutions very, very rapidly. We test, iterate, rebuild, test, and go on that way. We also want to surround our solutions, not just deliver them and then walk away. We want to surround them with good support, good training, good documentation, good education. So we develop online support methodologies, good documentation, online training, and enable people to really continue using the solutions we use, because it's so often in our industry we implement solutions and then we walk away and hope that the solution keeps on living after we've stepped away. And if you go back 6 months later, even if you do bother to do that, you find that people have either gone back to what they were doing before, or they're doing something completely different. And all the effort you put in is probably not realizing the outcome you hoped would be realized. So we don't like that to happen. It's not a fault of the people usually that are involved in the process, but really of not having good support, not having good training, and continuous support, documentation, where people can continue doing the things that you thought would be good to do. And so if you look at this, the way the group is constructed, it's really constructed in a way that we're almost like a company within a company. The only functions that we don't have in here are sales and marketing, and that's something that Rob and I and others do within the institution, as well as outside the institution externally too.
So this is Rob. The one thing that I'd love to add to that slide is that no single tenant of our group could stand by itself. It's critical that they all work together, and that's what we do as a team. You can't have development without important, critical design. You can't have development without training and documentation and support. You can't have support if you have nothing that you develop. So all four pillars of our group work hand in hand to ensure that the solutions that we develop meet the consumer's needs, and then we support them throughout the life cycle of that solution.
Right. Thanks, Rob. And the other thing we like to do is simplify complex problems, right? Bring them down to the core and better understand them before we make something. So that also goes into the philosophy that we have in terms of understanding our consumers. So we think that consumers really, it's not a complex algorithm of figuring out what exactly they want. There are three things that they want, like everything else digital, right? We think that healthcare and education are so different that, we've got to have this very special model for us. But, if you look at just the human aspect, and you consider yourself also as a consumer sometimes of these same services, what you and I want and what everyone else also wants, and this is not just us introspecting, really is access, ease of access to services. And in healthcare, it's really been a horrible situation when you think about that. We don't provide access. We don't allow our patients to really interact with us in as easy a way as possible. We present restrictions. It's not the consumer that does. It's not the consumer asking for something really untoward, unexpected. It's just that we do, and we've got to break some of those barriers. Then convenience, consumers want these services available where they reside, if it's on the web, if it's on social networks, if it's in mobile in terms of devices, even in wearables that are soon going to get a lot more sophisticated, that we can actually engage people through them. Directly through them, using them as technologies. We already do it with Apple Watch and such other technologies. And even in the Internet of Things, as you've seen, a lot of devices kind of almost invading the home, making their way into the home, and people want to interact via those devices. Maybe they want to speak to their physician, through those types of devices. There's no other intermediary. There's no computer. There's no phone even. It's direct interaction. So we're thinking about all those spaces and actually doing something about it too. And then finally, the consumer wants, we think, a great experience, a closed loop digital experience. The kind that you experience when you purchase things, let's say, with Amazon or Zappos, or some of these great companies that have figured a lot of this out because they've focused on it, and they've decided that that's going to be primary to their existence. And so they've developed these great experiences. When you buy something on Amazon, for example, even when it ships to you, it ships with a return label, so in case you didn't like it, you can send it back. You don't have to necessarily get on a phone with somebody. Even the whole process of purchasing with Prime and all of that is really delivering those closed loop kind of digital experiences and understanding that that's of value to the consumer. I think we need to do that more in healthcare and in education. So those are our what we think, in consumers in healthcare and learning just want services like everything else digital that they already experience. It's not something new. So how do we address each of these things? Well, one example is, we'll go through a few examples here, but one example of access is, and other hospital systems are doing this, but I'll talk about something that's slightly different than what you might experience at other institutions. So we came out with an app called My Jeff Health. We went through 2 iterations of the application because we care a lot about how consumers themselves think about what we've developed for them. And so we do primary research with them as they come into our clinics or hospitals and leave, and we expose them to the tools we're making. We develop them fast enough so that we can do that, and then we develop them on platforms and in ways that we can change them very rapidly. And as you can see, if you go to the Apple Store, you go to the Google Play Store, you can download My Jeff Health. It's an app that's available, and you'll see the attention to aesthetic, to ease of use, to the ability to finding things, to the understanding that people are not just coming here for health. If it's the healthcare side, they're not just coming here to go to a clinic. When they come here, especially to the city, they want to know about parking. They want to know about what food is available in the area. They want to know about how to get here, So we've developed this concept called Journey to Jeff, where you can build such an itinerary, save those journeys, share them with your caregiver maybe that's going to actually be getting you here, or with someone who's going to be doing it for the first time, So we do all of that. You can even call an Uber from the app, to get to where we are. So we all we have to do is step back and take that 360-degree view of what someone's trying to do or with your system. Not just they're coming here to see a doc. No, there's a whole process around that, and you got to take care of that. So that's one manifestation of providing access. Then we, for experience, the type of experience that we provide, the closed loop experience, right? So most health systems have these portal tools. So patients download an app or get on a computer, then go to a website, they create an account, and they can see their labs and those types of things. We have that too. But adoption statistics across institutions show that not a lot of patients actually download these apps or go to the websites very often, because patients see healthcare as being episodic. But if you think about it even in an episodic kind of way, they are not just episodes, but many times they're journeys. So if you get pregnant, that's a journey. If you get diagnosed with cancer, that's a health journey. If you have a heart-related issue or a heart health issue, that's a journey. If you have diabetes, that's a journey. So all of these are journeys, and the way that you interact with a health system when you get on those journeys needs to be completely different from what a canned portal product can develop. So that's why one of our focuses is the journey area. And so our first foray into that space is developing a pregnancy journey. And we have an app out called My Baby at Jeff, which is used by our OBGYN groups. Now it's going to be used across our whole system. So we are putting in additional information based on that need. and it's been pretty successful. So but again, what the patient sees is, okay, Jefferson really cares about how I interact with them, and they're providing me with this additional experience. For us, also, what it does, apart from that goodwill aspect, we can then engage more deeply with our patients. If you had a cancer app, a cancer journey app, we can expose clinical trials because we're a research institution too. We already have a telemedicine application, so now we can channel the telemedicine aspect into these journeys, so that someone can get on a call while they're in this journey app, or get on a video call immediately if they wanted to with their physicians, already filtered by their care team. So all of these services create this real nice closed loop experience. The middle image that you're seeing there, it's called At Your Service, is an application that we developed, again, in-house, that we built up really rapidly. And what it does is it enables administrators to round within our system, and we do this with immense discipline in an agile kind of manner every week, where a lot of hospital administrators go around and round not just with patients, but also with employees. Deliver honors, to employees for good service, collect data from patients, and on the fly within the app, triage those issues. Like, let's say a bed was broken or the HVAC is not functioning properly in that room. Triage that directly to teams that are supposed to do that work, and then they solve those issues while these patients are with us. In most hospital systems, this type of experience information and this type of information is collected after the patients are discharged from the hospital, which really, the patient doesn't see as engagement, right? And all you're doing is collecting their information. They don't see that you're actually doing something about it. And this is our attempt at ensuring that is not the only type of experience and engagement effort that we conduct, post facto. This is while they are with us. And many times, if you revisit that same patient while they're still with us, you can report this information to them, and you'll see some metrics behind that and how it's really affected our bottom line. And then MyJeffEd is a tool that we're using with Illusion, a company that makes the student information systems. And MyJeffEd addresses the needs, the journey aspect of a student within the system. And that is slated for release at the end of this fiscal year, which is early July. So I just wanted to kind of memorialize the fact that these things that we do are not just cool things. They're things that matter not just to the patients but also to the organization, because many times financial groups within the organization and even leadership wants to see, okay, well, I'm investing this money in developing a tool or a process or an application, and I have these teams of people that do this. What's the direct benefit to the organization? And there really is, great benefit we found. We always knew that, of course, but as long as you ensure you use design teams, for example, or some kind of team at the outset of developing anything, and you vet that and you ensure that it's something that ensures those three wins, that the team itself gains, and can grow so that they can do more things, because otherwise you get encumbered by several things that you've developed and then you can't make anything new. So the team wins, the patients and our consumers and our students win, and also the organization wins, because if even one of those constituents loses in the process, many times you can overall lose out, and the application could get sunsetted or something like that, or the process that you developed gets sunsetted. So we see real benefits. This is a quote from our president of the hospital system. The next quote is from the CEO of another hospital that is within our system, and he directly credited this application for moving us from a 2-star to a 3-star rating on the CMS. Something that they've been trying to do for quite some time. Increases in HCAP scores, which is our patient satisfaction scores, credited directly to these applications. So and then even increases in numbers of patients and patient volume. We've seen data to support that directly from these types of applications and these engagements. Jeff Connect, which is our telemedicine tool, is a tool that addresses the convenience aspect. I'm going to speed up a little bit because we could be running out of time. But you may ask. So those are some examples. I want to be sure that I made a point to get the message across to you that we need to understand the consumer. We need to understand what they want, and then beyond that, execute on things that matter in a way that these three groups really win. The consumer wins, people that make these things win, and the organization wins, right? So those are some examples of that. So how do you, but the question that might be still in your mind is, okay, how do we do that, right? Yes, we focus on good design and do all of that, but again, to answer that question, I am trying to simplify it as much as possible. Okay, I don't think it's huge and complex and difficult to do. Digital transformation and the equation for that we feel is very simple. It's great teams, great platforms, and great partners. Now, it may seem simple, right? But to be able to execute using that formula it takes a lot of investment of time, because when you're trying to build great teams, you need to spend a lot of time, and sometimes take your own time about getting the right people into that team. So we have, for example, 12 principles that guide our teams. We expose people even at the interview level to those 12 principles. If they feel like they don't seem to connect to that, then we know we're probably not the right. We know that it's probably not the right place for them to work, right? So we get some of that culture right out to people before we even hire them. And then once you're in the group, it enables you to make better decisions, because there's some ethos, some principles guiding this team, in the way that we do things. The platforms, we take our time also in picking the right types of platforms, progressive, future-focused. They may not be the biggest platform that's out there to solve a problem. Many times it's the reverse, but it's one that is really, focused on the consumer, is design focused too, and a platform that's looking towards the future is open enough that we can develop on it if needed. That also is progressive enough that it's allowing or enabling you to then extract data that's in it and push data into it. So we're very particular about platforms, and we think that's important because innovation, as I've said, there must not really be the currency of a few, but the combined wealth of the many, and platforms can make that a reality. The third part of this equation is great partners, and I think we need to pick them with the same kind of attention to detail and that we place in picking people into our teams, and with the same kind of attention to a culture fit, as we have when picking people to work on our teams, right? Because great partners are not just focused on their bottom line, they are also focused on you succeeding along with them, and that really is a good partner. They involve you in some of their decision making. They let you know what new products they're coming out with or new features that they're coming out with, and also they engage you in the enhancement of their applications, because as part of that, your use cases can develop too. So those are the kinds of partners that we collaborate with. And overall, we understand that nothing really that we've done, even the past examples that I've shown you, are not just us going out and finding this, real cool thing. I mean, most people think that, right? I mean, when you see the startup world and all, even startups haven't started because somebody had this brilliant idea and then executed on it and on their own, right? I mean, it's large teams working together, small, large, whatever, working together, someone else finding a problem, someone else executing on it. And so we are very, very collaborative and open with clinical teams, with administrative teams, with academic teams, with research teams within our group. and ensure that credit goes to the right people, that we are, for example, an example I'm going to show you next is one that we presented at HIMSS, where we developed this application called Strength to Insight for prostate cancer study. So this is a funded study for a researcher, and he has been able to collect data using this tool. We did it very rapidly for him. It's on the Apple Research Kit platform. We used a great partner in a company called CloudMind, that's an MBAS solution provider, built it on that platform and did it in about 3 months. When some of the larger companies that do this kind of work were going to take about 18 months to do the same thing. Got the attention of Apple, HIMSS, we presented there on this topic, but ultimately the biggest benefit was to the patients, prostate cancer patients that are now submitting data on a longitudinal study over multiple weeks. And this is informing research. This is informing, quality of care measures and patient-reported outcomes over this extremely important study. So from the developer's perspective, this is very, very meaningful work that's going to generate some great future innovations in the space. So, but again, a very collaborative, initiative. We also work with IBM, for example, in developing something most people might think is easy to do, because you see a lot of consumer devices coming out that do these kinds of things. But when you start using try to develop the same use case in healthcare, it gets very, very complex. And then you need companies like IBM and Harman, who we've been working with on this, to work with you and enable a solution that's an enterprise level solution that can work within the constraints of healthcare. And so that's what we've produced. Again, something we've talked about at both World of Watson, IBM Interconnect, and a few other places. It's got a lot of attention in media, even at CES. This was presented as a great concept by Harman. They've started building what we've enabled through this process into more commercial other industries, like, for example, hospitality. And what this system does is it's almost like having a concierge in your room when you're with us. Most of the times, these questions that patients have are answered by clinicians, and we really want our clinicians focused on delivering great clinical care to our patients. And so if we have this presence in the room, which is really a Harman Kardon speaker that connects to IBM Watson, that takes not unstructured questions, so they don't have to be like how you interact with a skill on the Echo, where you say a specific phrase. No, IBM Watson doesn't need that. And in a healthcare environment, we didn't think that we needed to subject a patient to remembering those types of things. We just want them to have a fluid conversation with the room, and the room be able to, using IoT and IBM's cognitive IoT platform, be able to not just do some of the things that you see on the slide, telling them about times and about their docs and about their doctor and, about visiting hours and things like that, but also be able to interact with the physical room, change temperature, pull the shades if you needed to, play music, those types of things that slowly patients are already getting used to in their homes, right? So they want similar experiences elsewhere, but also at the same time saving the organization, both time, resources. About 10 to 20% of the time the time that nurses and physicians spend in a hospital are spent on answering some of the non-clinical questions that a patient might have. And since those don't get prioritized, the patient themselves, don't get responses immediately to these questions, right? And so the experience is not that great for them too. So there's a win-win-win, again, for everyone in this situation, and I think we've accessed that. Another great example of this equation working, I'll just flip to the next slide from here, is the work that we've done with Google on the cloud platform. where we've moved a lot of our web services into the Google Cloud Platform, providing a much more responsive web and a lot more great features, new features to come into the future on the web as a result of this. We also use the Google Cloud Platform and another MBAS platform that we use that uses GCP in the background to develop applications like our President's Dashboard, which we then used for other types of projects, for example, our integration work, that enable our organization to prioritize tasks, inform themselves and others that are on projects about the status of those projects, request help, and do those types of things. So a little bit of BPM in that. Again, Google worked very closely with us on doing these types of things and hosting the development spaces, Convey2 in that case. With Adobe, who has also been a great partner, we had about 6 content management systems at Jefferson and for the web, and we consolidated all of them into one. And we picked Adobe Experience Manager as a platform that we would use. And Adobe worked with us really, really closely to enable that vision because they see how healthcare and education are getting consumerized to that level, and they want to be in that space too, and they want to provide great experiences. So they're learning from us, we're learning from them, and we're getting some great synergies there. These are some examples of the web properties we've developed, full responsive on mobile devices also, using this great platform with Adobe. Into the future, we are also working with Appian, and maybe on the Appian platform for low and no code BPM work, because a lot of the work that we get coming to us, and a lot of requests that we get coming to us, are really business process management related requests. So instead of developing these discrete solutions that we then have to support in a discrete manner, we want to start consolidating them on platforms like, let's say, Appian, and do it in a way that we don't need extremely high-level developers, doing that, because that resource is very difficult to find, and also we have other developers on our teams that have not native development skill sets, but may have web development and platform development skill sets that we could use towards creating some of the applications that we would otherwise use, native developers on. I'm going to move ahead quickly, but at the core of all of this, we focus on 3 things. One, we want to increase earnings, definitely, for the organization. We want to build competitive advantage, and we want to accelerate processes. We feel that in accelerating processes, reducing latency, doing those types of things, focusing on the process itself. Many times we do things and we don't even focus on the process. Just bringing that to the fore, helps tremendously in building better consumer experiences, and so the consumer benefits there. In building competitive advantage and increasing earnings, the organization benefits. But the core behind all of this, at least to our team, is that consumer, because if we create great solutions for consumers, the benefits are tremendous. There's almost always a win-win-win in that situation. Some examples of other digital solutions, we build dashboards that reveal latency and then accelerate processes. So these are some examples of dashboards that we built. We also do this in the clinical environment, where this is an ED dashboard that we built for one of our hospitals, Abington, that enable them to really increase throughput, and even not just increase throughput, but also focus care to specific teams within ERs, and utilize the ER in a very, very efficient manner. The same with the ER here at Center City and Methodist. We won the CIO 100 award for these applications, which are now used widely in our ERs in Center City. which really enhance throughput within the ER. And there's some stats here on how that happens. This is another manifestation of that same dashboard, but I'll quickly show you some testimonials. When we implemented the agile ET processes and dashboards in our ERs, we dropped our left without being seen rate from 4.6% to 1.2, and this was within 1 month. We reduced the average length of stay for discharged patients by 42 minutes, the average time to physician by 23.9 minutes. And this was the processes, some construct of the ER, as well as these dashboards that generated these types of results. It's just tremendous. There's patient satisfaction there. There's a reduction in time, total time spent in the ER. When we see about 100,000 patients in just those 2 ERs, per year, and that differential of percentage of left without being seen, where people were leaving because either they couldn't wait anymore, or they just felt like maybe, okay, well, I don't need to have this condition seen in the ER. They were just leaving, now at 0.8% from 4.6. So that's thousands of patients right there. We also helped the medical oncology group reduce their time for chemotherapy insurance authorization from about 22 days. Imagine being diagnosed with cancer and then taking 22 days to really start getting chemotherapy, down to about 5 days on average now. And we did that in collaboration with these groups, with these clinical groups, revealing where the latency was happening, dispelling common notions of what latency, where the latency was happening. Most people think, oh, it's the insurers. It wasn't. It was within our own clinical system. So we revealed that. And data speaks, so we use a platform called Domo. They did some features on us and how we use them. We use them for the ER example I just mentioned. We use them for the chemo insurance authorization example. It's a great platform, but what really is happening in the background is what matters. It's teams working together, revealing a data story, and convincing the people that contribute to a certain latency or latency kind of situation, and convincing them that, okay, we are all contributing to this. Okay, and if you say that to them without data, nobody believes you. So you have to have that focus on data. This is an example of the One CMS project that we did. I'll skip over that in the interest of time. I'll skip over that one too. But I just wanted to end with some thoughts around how we do some of these things. And what you might want to do in order to, if you think this has been good, if we've achieved something here, what you need to realize is that what got you here, if you're experiencing a problem, will not get you to a point where you realize the solution, right? And you can't fool yourself by thinking that everything's just going to be all right suddenly or somehow. You do need new ideas. You need to look at other industries and how they've solved similar problems. You need that outside-in thinking. You need to engage in immersive development, because the reverse is very easy, to just be outside the problem and say, oh, I think I know what the solution is going to be, and here's what we should do, and let's try it out. No. The difficult part is to actually go. So when we did the ER project, for example, the difficult part was, no, we're not just going to design a new interface for your ER EMR. No, we're going to go and see if the solution that you're bringing to us is really, addressing the problem and is going to realize the outcome. So we're going to come with you to the ER. We're going to live with you in the ER, and not just us as in administrators, not just Rob and me, but the developers too. And we're going to see if that solution you're bringing to us and want us to execute on is really going to address that problem and realize the outcome. So that's hard, that's difficult, but you have to do it. Otherwise, 6 months later, 3 months later, worse still, 3 years later, you're going to realize you spent all that effort and achieved nothing. And then, use the lean startup methodology. It's great because nowadays you have technologies that you can build and solutions you can build And sometimes technology is not even involved in the process. When Abington came to us and said, we would like to use at your service at Abington, we said to them, well, first, the solution, the technology is not the solution in this case. It's really being able to stick to the discipline of going out and talking to these patients every week and having people engaged in that process and continue it over time. So we said, here, we'll give you that survey type of tool in paper and try it out for a month, 2 months, and see if people stick to it. If they stick to it, they show up, they come to these weekly meetings and then go out and meet with patients. Then we'll port the tool to Abington, and they did it. They proved that to us, and so we went ahead and did this work. So validate the problem or find the real one, then devise a solution, and devising it, build, test, iterate, and rebuild. Always be asking these questions. We're running out of time a little, so I have just one more slide. And I know there's probably a lot of tech people on this session. So I just want to say to you that, IT is not just a cost center. It's not even just a value center. It's really a change agent, and you can change different types of industries. You've seen it already happening all around you, right? I mean, it's not a mystery. It's not something we have to prove. But many times when it comes down to being in these meetings where people are discussing problems and hoping for solutions, IT can take a real lead role because information, as I mentioned here, can be a catalyst for change. Technology can be a driver for change. And we really believe a lot in Scrum and Agile and lean startup methodologies. And so we feel they can really be a great framework for change, not just in software development, but also across the organization. And that, I think, wraps it up for me. Rob, please let me know if I know I've monopolized a lot of the time, but if there's anything that you want to add to this, because you're really into the practical aspects of things, and we're all in this together. So
no, I appreciate that, Neil, and I appreciate that, and I want to give a chance to hand it over to our sponsor as well. But I did the note that I kind of thought, and then I'll answer any questions in the question aspect if we have them, is that while everything that Neil laid out is a lot of the surface of what makes what we do great and really what makes Jefferson a great place, there's a lot of core foundational work that's done behind the scenes with the technologies that we're laying out. So it's not just picking the right partners and having the right teams, but it's also having a really strong foundation and architecture when we put together solutions such that technology can be reused, it can be adapted, and it can evolve throughout time with the organization. And if you simply look at each project or each problem as a piece by itself, you'll end up rebuilding and re-architecting, re-engineering over and over and over again. But having a team that's dedicated to overall improving the consumer's experience throughout time forces everyone to look at every aspect of the experience, even when they're just iterating on a small problem. So the technology behind all of it is really critical to get that right and spend the time to do it and not just rush to solve problems. So anyway, more about that in the Q&A if people have questions specifically related to how we do all of that.
Yes, thank you, Neil and Robert, for taking the time to speak with us today. We do have some questions already in the Q&A area, and just a reminder, if you'd like to use the program to submit a question, you can use the Q&A area below the slide to submit a question at any time. I would like to introduce for a minute here Fritz Hamburger, who is healthcare consulting, sales, and management executive with more than 15 years of health IT, clinical operations, and revenue cycle experience. With a strong background in healthcare administration and operations, business development, and IT systems design, Fritz has extensive experience focusing on provider solutions both in the U.S. and internationally, including Canada, Ireland, and the UK. So, Fritz, I'd like to bring you into the discussion for a minute or two and just ask if you could share your thoughts and perspectives on what we heard today.
Sure, Rajiv. Can you hear me okay?
You sound great.
Wonderful. Thank you. Well, first off, just want to say thank you to you and the team there, and certainly to Neil and Rob as well. This has been incredibly informative, and certainly do appreciate your time. Just to certainly echo what Rob and Neil have discussed, the age of digital transformation is certainly upon us, and I think being able to work with those companies that really truly value those partnerships, as Neil mentioned, rather than having just a vendor-client relationship, rather taking it to that next level and having folks who are truly investing in your needs, listening to your needs, ensuring that you're on the same team to the end that you are both looking to achieve those same goals is incredibly important. We here at Appian certainly have done that in the healthcare sector and many others, and are certainly looking forward to working with Neil and Rob there at Jeff, as well as anybody else. We'll certainly look forward to our Q&A session here. So we'll send it back to you.
Great, Fritz. Thanks so much for a few minutes there. And again, thank you to Neil and Robert for a very informative presentation. As mentioned, we've already had a number of questions from the audience, but we'd once again like to remind you to use the Q&A area below the slide to submit a question at any time. The first question, and we'll direct this to Neil or Rob, for the app that you mentioned that was developed, how has it been shared with the public or with employees within your health system? How did you announce its release, and what kind of response has it received so far?
This is Neil. The app, but you probably are referring to MyJeff Health in that situation, because I spoke about a few. But yeah, MyJeff Health is really a patient-focused app, if that's the one we're talking about. So we do have some marketing behind it, but we haven't done some broad marketing. We've done a lot of broad marketing around Jeff Connect, which is our telemedicine app and solution. And we've got extremely positive response behind that, and lots of utilization too. It's developed into a national brand. Our next goal is really to start developing MyJeff Health as this national brand, and it be the platform whereby everyone accesses some of these solutions or all of these solutions. So, Jeff Connect being available within MyJeff Health, our portal solutions being available within MyJeff Health. From the patient perspective, they've received it, it seems like, quite well. We have people using these applications. We have clinical units using these applications, like the OBGYN folks. We create collateral and marketing for these through our design group itself, and even web presence as needed. But yeah, I mean, the response has been great. Could we do more marketing? Yes, certainly we could, and we will in the near future. And Rob, if you wanted to add something to that.
Yeah, the only other thing that I'd add to that is that Neil mentioned a bunch of times that we have a very agile approach to things. So we try to put solutions out there that are going to create value for our consumers, but get them out there as quickly as we can, and start collecting feedback and analytics on how well they perform. So in pretty much all the solutions that we build, apps included, we collect data, not specific to a particular user, but just specific to trends about how often certain features in an app are being used, how long they're being used, similar to analytics that you would use on the web. But that allows us to figure out what pieces are more important and we want to focus on more, and what pieces are less important. And we do that in addition to collecting data through surveys and other ways of speaking with the population. So you'll see that more and more features roll out to these apps sooner and sooner, and it is all based on, in a lot of cases, real-time intelligence that we're getting about how the apps are being used across the different populations.
Great. We do have time for another question or two. The next one is also about apps for Neil and Rob. Are the apps you have developed EMR, EHR agnostic? Do you have APIs for these variety of EHRs?
Yeah, that is, yes to all of those, but I'll let, I know Rob might be excited to respond to that, so I'll let Rob speak. Yeah.
Yeah, so actually I can speak to that. A number of our Neil mentioned that we've grown over the past years and gone from 3 hospitals to 11, and we're about to add some more. So even within our own environment, we've had to manage multiple different EMRs at different locations. While those will certainly merge and migrate likely over time, that hasn't happened yet. And even at a given location, you see changes in the EMR over time. Some EMRs go end of life, or you switch from one EMR to another. So that's exactly how we've managed the solutions we've built, which is building an API layer that connects to back-end systems, and then having the front-end systems essentially be fairly agnostic of the back end. Now, everyone on this call who's been involved in healthcare IT for some time knows that you really can't have a truly agnostic front end. It would be great if you did, but we do have an API management layer in place such that our front ends look the same when we were on one EMR to when they have switched to another EMR, and we've simply added new services into the API management platform that we have and are calling similar data from a new EMR when we put that into place. And that does go to the overall note that I made at the end of the presentation, that building out a proper architecture for your solutions across the organization is critical, and that's what has allowed us to do that. So we recently switched EMRs at one of our campuses, and the dashboard, some of the dashboards that Neil showed, look exactly the same now as they did previously. Not only is that great from a development standpoint, because you don't have to go ahead and redevelop something, but it's also great from a process standpoint and an employee satisfaction and operations standpoint in the hospital, because those processes that were relying on that dashboard or that real-time data didn't need to change, and there was no re-education around those specific processes. So again, going back to how you architect the solution and solutions across your organization are critical.
Great. Thank you to Neil and Rob for answering those questions. And unfortunately, that is all the time we have for today. I would once again like to thank Neil, Rob, and Fritz for today's fantastic webinar. I would also like to thank our sponsor, Appian, for making today's program possible. Finally, I want to thank you and our audience for joining us today. With that, we hope you'll join us in the future for another Healthcare Informatics webinar. This concludes today's presentation.